The values, Christine, are so simple. Take care of your customer, your senior. Support the doctor. Use it. Now, we do use a lot of data and a lot of technology. We can get into that. But then the last one is just have a serving heart. Like, you got to care about your customer. And that's it. And then you say, well, how many of the big guys actually think that way? I would argue not a lot. And so that's what we've been trying to do. And so anyways, that's where my heart is to serve.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Most of us help our mothers, especially as they age. But for my guest today, John Kao, is a little bit more literal. John is the founder and CEO of Alignment Healthcare, a platform delivering customized healthcare to seniors and other vulnerable populations. John has an amazing resume, including CareMore Medical, the TriZetto Group, PacifiCare Health Systems, and FHP International. But his real passion is what he's doing now, giving seniors the specialized healthcare that they need. He's a servant leader to the core and serves on a lot of nonprofit boards as well. He has a fantastic story, and as always on this podcast, a lot of lessons to pass on to entrepreneurs. Here's our conversation. Well, thank you, John, for joining me this afternoon. I am so excited to have you, and congratulations on your recent IPO. I thought that's really exciting, especially in this tough market, to see somebody's having the IPO. I thought it'd be good for our listener to hear a little bit about your background, your journey that takes you to your founding of Alignment Healthcare.
Well, first of all, thanks for having me on, Christine. Yeah, no, it was a Sunday morning. I want you to think about Sunday morning, 7 a.m., about 7 years ago, I think it was 7 years ago. And I get a call from my mom, who at the time was 83 years old. And she's speaking to me in Mandarin. She's actually yelling at me in Mandarin and telling me to get over there as soon as I could. And I go, uh-oh, this is not right. And I go, what's wrong? What's wrong? She goes, I think I have a heart attack. And so I that's why when you said what you said about your husband, it just really resonated with me. And so I go over there, and when I'm there, the paramedics are there, the ambulance is there, the park ranger is there. I mean, everybody's there. And they had to break through the window to get to her and take her to the cath lab in one of the best hospitals in Orange County, Saddleback Memorial. And she had 3 stents put in. She was in ICU for 3 days, and then she was in the telemetry unit for another 3 days inside the hospital, where the care that she got was really good. But when she was discharged, it was as if she was just released into the ether, and nobody knew what to do. People inside the walls of the hospital didn't really communicate with her primary care or specialists outside the hospital. The pharmaceutical, the drug, the prescriptions were all different. I had to intervene, and I've been doing this for a while. I could talk about my background, but at that point in time, I just go, there's got to be a better way to provide advocacy and care for my mom. There's nobody we can actually turn to that has a holistic view toward taking care of her now outside the hospital. And really that was the inspiration for we setting up Alignment Healthcare, is to be that advocate for seniors, particularly those seniors that need the extra care, that are vulnerable, that have polychronic conditions, that are frail. And we like to say the healthcare system here is actually pretty good. We also like to say that the sick care system is not so good. It's not coordinated. And that my mom is my toughest critic. She's a member of Alignment Healthcare now. I'm happy to say we're serving almost 100,000 Medicare Advantage beneficiaries in 6 states. And the motivation is to treat every single one of them like my mom. And that's not to say, my mom doesn't yell at me on everything. I mean, she complains. Right? I mean, you're but she makes us better. And we have now a nurse that sees her every week at home. She can go see her primary care. She can go see whatever specialist she wants. She's got the best coverage in the marketplace from an insurance perspective. She gets groceries because she has a grocery benefit. She has over-the-counter benefits. Her house looks like a drugstore. I mean, there's a lot of benefits that she has, but the most important thing is somebody's paying attention.
Mm-hmm.
Somebody's paying attention to her at her house, and it's all free. It's just all free. So I think back to your point, the main thing is I'm so passionate about doing this because I feel called to do it. I feel it's all of my training, all of my experiences, all of my lessons learned, as you say, have led me to this point to form this business to actually serve people, actually take care of people, serve people. Nobody likes their insurance company, right? Nobody really cares or likes their insurance company. But so what if we get an insurance company that's taking care of the money part of it, but also takes care of people at their home and cares just through good service. It's so simple. The values, Christine, are so simple. Take care of your customer, your senior.
Mm-hmm.
Support the doctor. Use it. Now, we do use a lot of data and a lot of technology. We can get into that. But then the last one is just have a serving heart. Like, you got to care about your customer. And that's it. And then you say, well, how many of the big guys actually think that way? I would argue not a lot.
Mm-hmm.
And so that's what we've been trying to do. And so anyways, that's where my heart is to serve.
Yeah. No, I'm just interesting because you're saying about how you feel that once your mom left the hospital, the advocacy for the patient, the support that you get. I mean, considering you know your family background, I feel like you can afford you have the capacity to provide a lot of support, yet you don't get, let alone other people who are in different background.
Yeah, we had the best health plan. We had the best medical group taking, global cap. We had the best hospital. We had the best cardiologist, and yet the system was just not aligned. It just wasn't coordinated. I had to go to the PCP, beg them to authorize home health care, beg them for cardiac rehab. And they did it, But to your point, I'm in this business. I've been doing this for a long time, and I was like scared. It's not even the confusion. You're just scared. Like, what do we do? And so being able to provide that peace of mind and to coordinate all the different pieces of the insurance, the specialists, the hospitalist, discharge, all of it has given her a lot of peace of mind. And the goal is, I think, that every single senior in this country deserves that level of care. They just deserve it. And I don't think they get it. And that's to say, we have the best hospitals, we have the best doctors, the best research, we have the best technology, and yet the incentives and the payment models and the data interoperability is not quite where we need it to be. And so we're going to think big and change the world there.
That's right. And so maybe you can tell us a little bit more detail in terms of the Alignment Healthcare. Like when you first started, like with all the experience that you have with your mom, and it's like, okay, this is what I think is missing, and then how Alignment Healthcare can address that. And you mentioned a little earlier about the grocery benefit. Is it part of the whole system as well?
Yeah. So the whole idea is predicated on this kind of 20/80 rule. that 20% of your members of the population actually account for 80% of the spend in healthcare. Okay, and Deloitte, I think, has had a published a report that kind of supports that thesis. It's a couple of years old, I think. And so the idea is to use a lot of data to identify who that 10 or 20% of the polychronic are. So if you know who they are, you can do something about it and intervene earlier. And so we ingest a lot of data, and we use our own functional algorithms and machine learning algorithms to identify who are the high-risk individuals that we think have a high probability of being hospitalized in the next 30 days. And so then, if we know who they are, we reach out and engage them. And then once we have about a 63% engagement level of people we think are eligible for our high-risk program. And then what we do is we take our clinical teams of doctors, nurses, case managers, social workers, APCs. We're taking all our clinical teams to care for these people at the home to ensure that they don't have secondary complications. And my mom has 3 or 4 chronic diseases, and early stage diabetes, early stage CHF because of her heart, and some neuropathy starting. And so the whole idea is we send nurses to the house to just make sure they are stable, they are improving, they are healthy, they get the transportation they need, et cetera. If we do that and we stay on top of the little things, it prevents admissions into the acute setting. And what that does then is you have a happier and healthier member because we're caring for that population with very dedicated and focused resources. And then what happens is you can bend the cost curve. You can actually lower overall costs. And then in Medicare Advantage, if you lower the cost, you have to share that savings on to beneficiaries. You can't just put it in profits. You have to invest that in richer benefits and richer coverages. And so that's what's been driving our growth, because we have really good care. We do well by doing good, by serving this vulnerable population. And then we invest those savings into richer benefits so that all 100% of the population has good coverages and richer benefits. And those benefits now include not only traditional health insurance coverages, doctors, hospitals, home health, just whatever, traditional health insurance, pharmaceuticals. But now the CMS is saying to the health plans, we want you to cover other supplemental benefits that are needed for social determinants of their health and social determinants that relate to health equity. And so the logic is, look, if somebody can't get access to care, there's going to be a problem. If they can't eat because they're making a trade-off between co-pays on their insulin and food, they can't, they're going to get sick. So you have to help them with their daily living needs. So ergo, grocery benefits, caregiver benefits, over-the-counter drug benefits. What else? You're going to laugh at this one. Pet care, pet walking benefits. Because when the senior has a pet, they go to see the hospital, the doctor, or they go to the doctor. They want somebody to take care of the dog. I mean, my mom's thing is just grocery shopping. It's like she's 90 now. She's having a hard time driving. So just transportation benefits are also part of the package. But sometimes she wants a dedicated person to come in and shout out to the guys at Papa. Andrew, this is for you. But it's a great service, and they come to her. They pick her up. They go to her Chinese grocery store. They get her Chinese groceries and take her home, and it's an hour in the week. It's a huge benefit. Things like that.
Mhm.
And that's the whole model. Take care of the people that need it the most, because that's where all the money is, and then invest the savings in everybody else.
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
So you're saying that you're focusing on the 20% of the people who have a polychronic or the chronic condition. And I'm just thinking about the health plan, and it's all about risk. And oftentimes they have to balance it with the healthier population. And that's not how you approach.
But what happens is the traditional legacy plans, I think, they create products so that the sick patients don't enroll. That's
Mm-hmm.
not what we do. We want everyone to enroll and then take care of them. We actually take care of all 100% of our members.
Mm-hmm.
We just happen to think that the 80% of the people that cost 20% of the spend, they get pretty good care right now. They go to their PCP. We have to improve their access to subspecialists. But generally, the care they get is working. We have to make that the right network of providers. That works. But the focus of our internal resources is on that 20%. That's what drives down the overall cost. And you do that without compromising member satisfaction. You got to have happy and healthy members, you know, and and we work with the community PCPs with this model of care, and they like it because we're seeing the really sick patients at the home. We're an extension of the PCP's practice. So that's basically how we built the model, built the company.
Does that mean, like when you look at Kaiser, they have their plan and they have their provider. How is it yours different? Like, do you team up with the providers?
Yeah, I personally think Kaiser's the gold standard. I think it works. But there, it's kind of the same model. They provide good enough quality, but really low cost. I mean, and the value they create for consumers, both on the commercial side and the Medicare side, is really great. You know, I mean, is it the best of the best? From a quality, I'm not sure people would say that, but it's very good. I mean, I'm not right, but the value created is extremely high. And so, to the extent we can create that virtual vertical integration with community doctors and contracted hospitals without owning all the bricks and mortar that you have with Kaiser, and we don't need to own our own hospitals. We don't need to own our own practices. We don't have to have all the owned clinics. The community providers in each marketplace, no, they don't all want to get sold to the big consolidators or get sold to all the hospitals. A lot of them still want to remain independent. And so those are the ones we work with, and we make them better and support them. That's how we do it.
Yeah, I want to segue a little bit to talk about your background. I think you have a lot of experience before you start Alignment Healthcare, but you have pretty interesting career before you land in healthcare, actually.
Yeah, I was born in Taiwan. I was just an immigrant kid. My parents came here when I was like 3 years old, and built the American dream. Fought for their family, um, and I kind of grew up here, and I have a finance kind of background. I joined a company called FHP in Southern California. That was back in 1994, I think it was. And it was it was like a vertically integrated version of Kaiser, but in Southern California. It's FHP. And so what I learned there was how vertical integration and the kind of the staff model, how a staff model works. That company was actually merged with a company called PacifiCare in around 1996, I want to say. And PacifiCare was all about Medicare Advantage and had 1.5 million Medicare Advantage seniors. It was all about partnering with doctors, like healthcare partners, medical groups. And then I went from Pacific Horizons to a company called TriZetto, which was a systems company, a data technology, healthcare IT company that my friend and partner, who was the CIO at FHP, Jeff Margolis, founded. And so I worked with Jeff, and we grew TriZetto from, I think it was 40 million or something like that, to 400 million. And then I went to, and there I learned about systems and supply chains and operations, and then in 2004, I left TriZetto and joined my former boss, Alan Hoops from PacifiCare, who was the CEO of PacifiCare, and we went out and we bought a company called CareMore. And in 2006, we closed on that. And CareMore, we learned that we can bend the cost curve. We can provide a better level of care through focused clinical resources. And what's really interesting at CareMore is here I am, kind of a health plan, guy, thinking that we're going to do all these things inside CareMore. And what happened was just the reverse. CareMore changed us. The care delivery culture changed us. So, but we learned about how we could do chronic disease management at scale. And so if you can't take staff model, provider partnerships, systems and data, and then chronic disease management, you put it all together and you kind of get Alignment Healthcare. Mm-hmm. And that's why I feel, kind of obligated, called, obedient, whatever you want to say, to actually do this. Because to your opening regard, it's really hard. In the early years, it was really hard.
Mm-hmm. I mean, you mentioned that how being in CareMore changed you. In what way does it change you? Just give you a different perspective that things that you've seen should be done differently?
Yeah, absolutely. Because when you're from a big health plan company, you look at things, purely financially, I would say. You look at things from big data. You look at things contracting. We didn't understand the care delivery, how doctors and nurses and case managers work and serve that senior. And so having the empathy and the understanding for that, I think is a critical component of our culture. Mm-hmm. Is just support the doctors, our second best. Put the senior first, but then never to support the doctor. The doctor, do whatever, support that doctor, and then have a serving heart. Those are things that I think embodied CareMore, and I think Alignment has taken the lessons learned, the successes, and the opportunities to make things even better. And an example at Alignment, and the example there is we lowered CHF admissions at CareMore by 50%. Really good clinical outcomes. But we did a retrospective review, and we looked at it and we said, we're still missing about 40% of the people that were still going to the emergency department still were diagnosed with some form of CHF, so cardiac issue. And you go, well, we're banging the cost curve 50%. How could we miss all these people? And the answer was we didn't have enough of the data early enough so that we could intervene early enough. And so the whole concept of Alignment is, if we can get the data and use that data to identify the people that have high risk, we can intervene earlier. And we can continue to even further improve the quality of care by helping people earlier. And at the same time, lowering the overall trend. That's just one example of lessons learned. There's lots of lessons learned to go through with you.
Yeah. One of the things that I noticed that you talk quite a bit is, because you're founding the Alignment Healthcare and you have to build the team. I'm sure, your team has grown quite fast. One of the things that you mentioned about is servant leadership. And I think that's a concept that many knows, but many don't. If you can tell us a little bit more about that, why do you think it's important? Why do you think that is something that you emphasize a lot in Alignment Healthcare?
This is another story. I was involved in a church, and served on their elder board, and I thought that I would take some of my business skills and help the church in their financing, because there's a whole business side to church also, but would help with them on the business side, and I would teach them about the business. And what I didn't expect, which was just the opposite, was they taught me about taking church into business. And it's all about serving and having a serving heart and having a servant leadership view that if you want to lead, if you want to be successful, you got to be prepared to serve the people that need the most care. And that's what happened to me. And I remember the first year when we started Alignment, we went to the whiteboard and people would write down their words. They were asked to write down, what does alignment mean to you? And people would say chronic care delivery. People would say helping seniors. People would say use of big data, etc. I wrote servant leadership. This was 8 years ago, and people were like, what's he talking about? Like, what does that mean? Like, they couldn't correlate it. But over the years, people's thinking now is, now I understand. This is all about just taking care of somebody as if they were your Chinese mom, and serving them. And if you have a Chinese mom, you're serving them because they're yelling at me the whole time. So but that's really the impetus of it, and when we started the company, we're dealing with private equity, venture capital, all this stuff. And we were a little bit sheepish about the cultural piece of serving heart, mission orientation, because you're with these Wall Street guys. And now I would say that's why people join us, because the business model part of it, you're a viable business, you're public, all this stuff, but they want to be part of something bigger. They want to be part of something important. They literally want to change the world. They want a hand in changing the world. This is what you're doing. You're like changing the world. You know what I mean? I mean that. And so the cultural dynamic, the serving heart culture, plus this whole notion of the virtuous cycle that I just talked about, meaning know who the vulnerable are, take care of them, reinvest savings into richer benefits, grow. That whole virtuous cycle by doing well, by doing good, I think what attracts people to our company now, which is why it's a tough labor market. We get really good people because of the culture. So that's what it means, serving heart to me.
And how do you maintain the culture as the company grows?
That's the number one thing that keeps me up. It's very insightful. So as we grow and as we grow geographically, we've invested in Amanda and Priya on this call. It's in communications. Everything is communications, internal communications. When we took the company public last year, all of my focus was external communications. And I didn't do enough internal communications. This year, it's still external communication with investors, but internal communications, training, development, investing in people, and investing in the people we have, making them better, and then having culture carriers, people that have been with us for a while. Their job is dedicated to go to some of the new markets to ensure that they instill this level of commitment to the senior, and it just starts with the board. It starts with me. It starts with our leadership team. And so it's this trickle down. Everybody has to have the same kind of culture. And then you have to make sure that the systems, the communication systems, the cadence of training programs are all employee communications. Senior VP, VP, director, AVP, all separate communications I have weekly. I have 2 or 3 of these communications. I do these kind of CEO connection lunches. I used to do it in person pre-COVID, but I want to know what's really going on in the company, and I want to share with them how we need to behave with our customers and our providers. So it starts with me in communication, um, uh, uh, um, and the communication has to be consistent between internal, with the internal, with our stakeholders, the board, with our investors, and the external community. Everything has to be consistent, and it's kind of easy when the values just transcend all of these different stakeholders because you're doing the right thing and you're producing a return. You have to. I always say, and I don't know if our public shareholders are like this, but the goal is to serve seniors. If we take care of seniors, the financial stuff will follow. If we do the right thing, the growth and the profits will come. And I also say profits are not a goal; they're a requirement.
Mm-hmm.
It's like air. You have to have growth. You have to have profits. But the goal, the mission, is to serve. Serve your mom, serve my mom. Make sure they're taken care of. That's it. Very simple.
Mm-hmm. Well, that's great. No, I think we are running close to our time, and so I'd like to. I think you mentioned there's a couple of lessons learned there, but what are your top 3 lessons learned that you think that you always remember now as you go through your growth of the company?
I would, yeah. So number one is I had to learn to transition from a founder to a CEO. They're 2 different jobs. And so to all the entrepreneurial founders you have out there, you just got to be consciously aware of that. That's kind of number one. And as a founder, you're the visionary, you're the chief bottle washer, you do everything. You will things to happen. As a CEO, you have to hire the right team. You have to empower, you have to communicate, you have to train, you have to teach, and because you can't do it all yourself. You have to grow and build an organization that's sustainable and have the systems in place to make them successful. And so recruiting is of critical importance. So that's kind of the number one lesson learned I've had. And I had to be trained by our board to grow into that CEO role. So that's number one. Number 2 is, I would say, and this is a hard lesson, but I'll say it anyways. Is the number one problem with startup companies or early stage companies is they don't change the management teams fast enough. And I know that's a hard thing to say, but I've learned that, and I've talked to various different parties, and you're loyal to your friends who you started the business with. You always take care of them. You make sure they're taken care of. But for what's best for the company, you got to get the right people in the right roles. The same person with a title when you're $0 of revenue, and you got to make sure that person is going to grow with you when you're $1 billion in revenue. And sometimes that may not be the case. So that's as the founders, entrepreneurs in this podcast that you're listening to this. That's a hard thing to learn, but it's a lesson. And I say number 3. Be really choosy about who your capital partners are. Be really selective, because there will be tough times in your journey, and you want them to be there with you. And we have been very, very fortunate to have General Atlantic, Warburg Pincus. These guys have been fantastic partners, and have stuck with me and stuck with the company. Now they've been rewarded for it, It would have been easy sometimes in the early years for them to go a different direction. And so I really think choosing your part, don't just go after the first money that comes to you. Be choosy. Those are my 3 top lessons.
That's great. That's a good lesson to have. And so thank you so much for your time. It's really fun.
Thanks, Christina. Sorry I talked too much, but you got me going here. So.
Oh, no, this is great. This is good. I really appreciate it.
Yeah, and I think what you're doing is fantastic, by the way. And let us know if we can help. Really, I think it's just fantastic.
Thank you.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.